Harare seems to have the highest number of cases. And obviously, with the kind of efforts that you are embarking on, is the ministry doing enough in terms of testing Harare, which is considered a hotspot for the virus?
The total numbers that we're testing of the small numbers that I've just given you are actually indeed coming from Harare. Let me just remind you of our enhanced testing strategy. We have said we want to first of all make sure we're using PCR more than anything else. I think the slight confusion at the beginning where people were doing rapids for the wrong cases is gone now. The rapid tests are supposed to be just for screening purposes, whether you're looking at the borders and so on and so on. When you're coming into the hospitals, and that's coming to our strategy, testing everybody on the wards who has a temperature, flu-like illness, pneumonia, malaria, you name it. Patients on the wards must just have a confirmatory test, i.e. the PCR. And that's what we have done. We're ramping up that to really make sure that we're doing that. In addition, those who are coming from the hotspots outside, our returning residents, they have temperatures and so on. Even those who don't have, they must just have a diagnostic test.
Let's look at the examples from Africa. I know Senegal has made so much strides in terms of containing the virus. They've made sure that they test every individual, whether you have it or not. Is the same applying in Zimbabwe?
The same can apply anywhere in the world. If you're looking at the resource-rich countries, America, they're struggling. They can't quite test anyone, and they can't test everybody. And yet they are so-called resource-rich. We in Zimbabwe, we also look at our resource and say, if we have so much, how can we prioritize? How can we target? While we at the same time continue to mobilize resources to do the ultimate that needs to happen. If we have more than 13 million tests and so on, PCR, absolutely, we've got to test you and I and everybody else. That just gives you the confidence that you can pick up, identify any cases in Zimbabwe. If you don't have that, please don't get stressed, panic, or so on. We are there as your experts in health to try and help prioritize and say, how can we target? Our testing strategy is exactly that.